Well, hello, everyone. Welcome. Hi, everybody. I'm Jada Shapiro, founder of Boober. We have Dr. Harvey Karp here today, but as you're coming in, I'm going to introduce us in a moment. I'm going to let you all come in. It would be fantastic if you could chat to us. Let us know where you are in the world at the moment. Where do you live? And how far along are you in this pregnancy? How pregnant are you? Or how old is your baby? We would love to know. It also lets us know that you can hear us and that you're out there. And it helps us create a bigger sense of community. So as you are coming in, who's going to be the first one to chat us and tell us where you are? There we go. July 3rd, 2021 in Tampa, Chicago, 37 weeks. Welcome. New York City, 24 weeks. Hey, Leslie and Steve in San Francisco, 22 weeks. Annie, 37 and a half. New York, 32 weeks. Now you're going faster than I can keep up with. So I'll let you guys get that. Fantastic. We're in California, we're in Chicago, we're Brooklyn, we're all over. We've got 3.5-week-old baby. Welcome.
LA and Kansas City, I saw it too. And Atlanta, Georgia. Yay, Georgia.
Yes. LA, where you are, where I am from, where Dr. Karp is right now, I believe. Let's see. New Orleans. I love it. You guys are from all over. It is so fantastic to see people coming.
Actually, we're just doing work now with Children's Hospital of New Orleans. So laissez les bon temps rouler.
Yes, indeed. And while you're coming in, I'm going to actually throw up a little poll just as you're continuing through this. Let us know. It's nice to see the breakdown of where you are in the pregnancy or if you have a baby. And then I will share that with Dr. Karp. This is really an opportunity for you all. We're going to talk a bit. I'm going to interview Dr. Karp, and then this is a great opportunity for you guys to ask questions about sleep, safety, SNOO, all of it, COVID, whatever is going on for you as we think about your baby. We've got more people, Phoenix, New York City. You're welcome, Emily. Thank you for coming. So it looks like we have people in all different places of their pregnancy. We do have 2 babies that are under 1 month old with us. We have 3 people who have babies aged 1 to 6 months, 4. And then we've got a lot of people anywhere from, anywhere in their pregnancy, actually spread all evenly across the pregnancy. So thank you all for answering that. I'll just share the results real quick as a few more people are coming in, just so you can see where we are. Fantastic. So I'm going to go ahead and introduce myself and then introduce Dr. Karp, and then we'll get going. So my name is Jada Shapiro, and I'm the founder of Boober. Boober is a platform where expectant parents and new families can find all of their pregnancy to postpartum care providers, such as birth doulas, postpartum doulas, lactation consultants, mental health therapists who focus specifically in pregnancy to postpartum. We also provide classes such as childbirth classes, newborn care classes, prep for postpartum, infant CPR and safety, a whole host of classes to help you through pregnancy and postpartum. I've been in this field for 18 years as a birth doula, postpartum doula, lactation counselor, all of the things myself. And I'm a mom of a 13-year-old daughter, and I have 3 stepdaughters aged 11 to 15. So here just to support you on this journey, and very excited to have Dr. Harvey Karp here. We're so excited to have you. Dr. Harvey Karp is the founder of Happiest Baby and the renowned infant SNOO bed, which you're going to learn today, the responsive bed, which has won numerous awards and is really changing the game in sleep, as you'll talk about. Dr. Karp is a renowned pediatrician with years and years of experience and just such a wealth of information about all of sleep safety and everything that you could want to know right now in this pretty intense period of time as you are all living through this pandemic. So we are happy to have you here, Dr. Karp. Why don't you go ahead and introduce yourself? We had a little momentary guest appearance. You never know what's going to happen.
That's my cousin. Hi, thanks for joining.
All right. Why don't you go ahead, Dr. Karp?
Well, my name's Harvey Karp, and as Jada said, I'm a pediatrician and practiced kind of like the neighborhood pediatrician for many, many years, decades here in Santa Monica, California. Originally came from New York and did my medical school training in the Bronx, and then came out to LA. And then I started getting interested in some issues that were really kind of unexplained issues in pediatrics. You know, it sounds so funny. You would think that we know everything about babies because we've been around them for thousands and thousands of years. And yet, as many of you are now learning, you know, different opinions and some controversies of things that you might think are all, settled. And so I got interested in why babies cry and how to calm them and what is colic and how to get babies sleeping better. And how do you communicate with toddlers so that you can help them be more emotionally resilient and patient and cooperative. And it turns out that there were a whole bunch of things that were really right under our nose that we really weren't paying attention to. And so I started writing books about that. And then about 4 years ago, my wife and I launched this new company, which has a baby bed that we built with leading engineers and designers. Really, it's not a baby bed. I know people talk about SNOO as being a bed, but what it really is a caregiver. SNOO is your older sister who's moved in and said, go to bed. I'm going to hold and rock this baby all night long. And if the baby's upset, I'll rock and shush a little bit more. And if I can't calm the baby down, I'll come and get you. So it's kind of a curious thing. Now today, if you have a nanny or a night nurse, you're pretty well off, right? But 100 years ago, and for the entire history of humanity, everyone had 5 nannies and night nurses. They were called your grandmother, your aunt, your older sister. And so today to have some help, it seems like, you should do it all on your own, but really no mother ever did it all on her own. So getting help from a doula is excellent support, or a childbirth educator, or a newborn care specialist, or a nanny or a night nurse. Those are all excellent ways of doing that. But if you don't have access to those, having a SNOO is a 24-hour helper, pretty much for the cost of a Starbucks coffee. So it becomes something that we now rent to people all across the United States, from truckers and teachers to leading executives and celebrities and pretty much everybody in between. So anyway, thanks so much for having me for today and to have this chat.
Absolutely. No, thank you so much for coming. So as we talk about, you developed the SNOO bed, which we'll hear a little bit more. I would love to talk to the people who are here. I'm sure would really like to hear first more about the 5 S's and the techniques that you've really codified to help parents help their baby soothe, help their baby understand kind of the norms, right? How newborns are born. And I know that we have so many parents here. We have lots of questions. And by the way, everybody out there, please go ahead and drop your questions into the Q&A or into the chat. And I'm going to be moderating the questions as we go on. As I said, this is an opportunity for you. So I really would love to just help the parents here understand what is normal newborn sleep.
Sure.
What should they expect, and what are the techniques that you really talk about to help support parents as they go along their journey?
So, starting at the first step, which is that having a baby is, of course, the most miraculous and incredible experience. And even when or you think what it's going to be like, going through it yourself is just, extraordinary. And what's so incredible about that as well is that that's really what you're here for, right? I mean, there's a book about breastfeeding called "So That's What They're There For," and really that's what we're here for. We're here for for having babies and raising the next generation. And it turns out that the way it always was throughout the history of humanity was that you lived in a little community and you took care of your brothers and sisters. You probably had 8 or 10 of them, and your cousins and your neighbors. And by the time you had your own child, you had taken care of 10 or 20 babies along the way, and you just knew how to do it. And you had helpers that were right there to support you. Today, we don't have our extended family around anymore. Most of us don't. And many people have very little experience taking care of babies. They're successful. I mean, they've done well in school and they've done well at work. And they think, well, I guess I can take care of a baby too. I've seen babies before.
Right.
And of course they can. It's not rocket science taking care of a new baby, but there are techniques that are involved. And it turns out I got interested because as a pediatrician, we're taught to tell parents that some babies just cry a lot. In fact, 10 or 15% of them have colic, meaning they can cry for 2 or 3 hours a day for week after week after week. And we don't really know what causes that. And that babies don't sleep well. You expect them to wake up every couple of hours throughout the night. They need to eat a lot. And that, you just have to suck it up and deal with it. And hopefully by 4 or 5 months, it'll get better. And it turns out that that makes sense. That's logical, seems reasonable. But what if it's wrong? What if babies can be calmed, even colicky babies? And what if babies can sleep 3 or 4 hours in the beginning and pretty soon sleep 5 or 6 hours? Well, we know that that's actually possible because studies of other cultures show us that their babies cry a whole lot less than ours. And one study that really got me started in thinking about all of this was with the Kung San, the hunter-gatherers of the Kalahari Desert. And they could calm their babies in under a minute on average. And so what I was telling parents was that, oh, some babies cry for an hour or 2 or 3. It couldn't possibly be right. And then when you think about it, my gosh, we can put a man on the moon. We can talk to Bangalore, India in 5 seconds. Why can't we figure out why babies cry or how to get them to sleep better? And then it's even more obvious because what we pediatricians would tell people is that, oh, well, you really can't do that. And babies that don't work that way, you just have to deal with this. And at the other side of our mouth, excuse me, we'd say, if your baby's crying a lot, or if your baby's not sleeping well, go for a car ride. And if you drove them all night in the car from LA to San Francisco, they'd sleep an extra hour or 2. And you would sleep an extra hour or 2, and anybody would sleep an extra hour or 2. Right. And we adults sleep in trains and planes, and we like rocking in hammocks, and we like the sound of the wind and the ocean. So you start wrapping that all together, and it becomes obvious that babies need rhythmic stimuli. Babies need to be held, rocked, and shushed. And that's not like a newsflash, right? I mean, anyone who's ever held a baby knows sit in a rocking chair, exactly right. You dance around with them. And when they're fussing, that'll calm them down. If it doesn't calm them down, then you do it even a little bit more bouncy and shush a little louder. And if that doesn't calm them down, then they're probably hungry and you're going to stop and feed them. And so the 5 S's, or really the Happiest Baby on the Block, which is almost 20 years now. I can't believe it's been out for that long. We've trained thousands of educators and childbirth education folks and doulas in this approach. So the concept is this, that our babies are born really 4 months before they're ready for the world. And that's the concept of the 4th trimester. That when a baby is born, it's not like, hey, baby, you're independent now, just deal with it. And while that sounds obvious, of course, you would never say that to a baby. At the beginning of the 20th century, that was the approach that we had to babies. Don't pick your baby up. Don't respond every time your baby is crying because you're going to weaken them or spoil them or get them used to being manipulative. And while there's kind of some truth to that, if you look at a 1-year-old and a 2-year-old, that if you always give in every time they scream, I'm not saying that you just ignore them. I don't agree with that. But if you always respond because they're screaming at you, you will end up teaching them that screaming is the way to get the things they want. But with a baby, we're dealing with something different. And I know you're an expert in this too, Jada, which is this concept of attachment. In other words, the most important job in the first 4 or 5 months or 6 months of life is to teach your baby to trust you, to teach your baby to feel secure, to know that the people who love you have your back and we're going to take care of you. And anytime you need something, we're going to be there for you. God knows in the uterus, before they're born, they're fed every second, they're held every second, they're rocked every second, they're shushed every second. So from the baby's point of view, big deal. You hold me 12 hours a day. That's a ripoff compared to where I used to be. Exactly. So from their perspective, they're expecting all of this holding and rocking and shushing. Our babies, because of their big heads, have to be born before they're really ready for the world. And so once you have the baby, those first 4 months, you're one big walking uterus. And it turns out when you understand what the uterus is doing, what the experience is like there, it turns out those are the things that calm babies down. So the 5 S's are, it turns out if you imitate the womb, it's not that the babies are nostalgic for it. It's not like you go, oh, that's like where I used to live. I love it there. You're actually turning on a reflex or flipping a switch. Babies are born with many reflexes: rooting, sucking, swallowing, blinking, over 70 reflexes that are built-in behaviors that help the baby survive. Crying, you don't teach a baby how to cry. They need to cry because that's how they get your attention, and they let you know that they have a need. So crying is a great thing, but if they were born without the ability to cry, they would die. And so it turns out that they're also born with an off switch for crying. And the way you imitate that or turn that on is by imitating the womb and turning on this calming reflex through 5 specific steps. And that's the 5 S's. So it's swaddling, snug swaddling with the arms down. The second is the side or the stomach position. Now, you never do that for sleep, only the back for sleep, but the back is the worst position for calming a crying baby. The third S is swinging or rhythmic motion. The fourth S is shushing or white noise. And the fifth S is sucking. And it turns out every baby is a little different. I mean, they're more similar than they are different, but they are different. And some babies, you swaddle them and shush them, and that's magic. Other babies, you swaddle and shush them, and it doesn't calm them at all until you add some bouncy motion. And some babies need 2 or 3 or 4 or all 5 S's all at the same time to flip the switch or turn on the reflex. And if it's not working, then usually it means they need something else. They need to be fed, or they need to have a diaper change or something like that.
Yeah. Thank you so much for that. I know that a lot of people really, they're reading the book, they're watching. You can go on Happiest Baby. I'm going to drop that in the chat so you can see more of your work there, but it's really nice to hear.
Data to emphasize that actually, and I love people reading the book, and it's got anthropology and all sorts of interesting stories and stuff. But the way you learn it, and especially the way guys learn it, is by watching the video. Yeah. So it's a little 30-minute video that we have. And the reason that's so important is because these techniques are techniques. It's like learning how to tie your shoelaces. You can read about it in a book, but you actually learn it better by watching it being done. So
definitely, and I'll drop the link to your site so that people can grab. You can go to Happiest Baby site, right, and get it directly there. Thank you. So we do have a question. I'm going to grab a couple questions from people, and we'll kind of continue to weave back in and out. Somebody asked, thank you so much for being here and for all your work. We're so excited, and we have our SNOO ready to go. But can you speak about having Bluetooth next to your newborn? I know we're around it so often. Are there any studies or anything done to show this is safe? Anything you can put in there about that?
Yeah, Bluetooth is a very low energy source. And so we have energy going through us, all the time, radio waves, television signals, the routers that we have in our homes, the appliances that we have all have, waves that are electromagnetic waves that are coming from them. And Bluetooth is a form of that. And so in general, it's good to kind of, minimize exposure to those things. I think that, like when you have your telephone and you have your baby there, you can put it on, the airport mode, so that it's not creating energy that you're being exposed to and the baby's being exposed to. If you use your phone as a white noise machine, some people do that, right. Always put it on airplane mode for that as well. And so I don't think there are any, as a matter of fact, I know there are no studies that have shown that Bluetooth is a risk to babies. And more the concerns that we have are like high tension wires or appliances that are large motor appliances that are near your baby or right on the other side of the wall sometimes, because these waves go through walls as well.
Thank you. And kind of on that, there's another question about overstimulation. Any recommendations within the nursery decor? Can you overstimulate a baby with dark and light, small patterned wallpaper?
Not really worried about that. I mean, babies have what we call self-regulation. So when they're tired, they close their eyes and go to sleep. When they're not tired, they wake up, they look around. But when they're feeling overstimulated, they will do certain things. They will look away. They will close their eyes. And they will moderate the amount of stimulation that they're getting, and even to the point of literally shutting down. So in other words, if Aunt Clara comes over and is going, "Hi, baby, hi, you're such a good baby," oftentimes you'll see the babies initially perk up and be interested, but that can fatigue them pretty quickly. And then they start looking away or looking down or closing their eyes and falling asleep, which isn't necessarily a tired sleep. It's more of a, I have to protect myself kind of a sleep. So of course, half of the day or more, the babies aren't even going to see the pattern of the wallpaper because it's going to be dark in the house. So I'm not overly worried about that. More intrusive noises and things like that are problematic for children. And in fact, stimulation, rhythmic stimulation is good. You almost can't give them too much of a rhythmic stimulation, holding, rocking, shushing, carrying your baby skin to skin contact is
yeah. Can we talk about that for a minute? Because I've noticed, at Boober, of course, we do a lot of childbirth classes, newborn care classes. I've been working with expectant parents for 18 years as well, and just getting always get these questions about, I feel instinctively I want to hold my baby, or, what do you think about, can I hold my baby too long? Am I going to be spoiling the baby? And I think, you just said it, like we're pregnant, we're carrying our baby 100% of the time, right? But I think hearing from you as an expert pediatrician about that idea where, that's a cultural thing that has kind of been handed down. The 1940s, when my grandmother, gave birth to my mom and was basically told never pick up a crying baby, right? They're manipulative.
Exactly.
I'm still recovering from that, working on it, right? Therapy. But, I think that's something, if you could address that a little bit, and then we'll get to some more of your questions out there, everybody.
Yeah, one of the things I would always tell my patients is that, we live in Alaska and the Amazon jungle. We're a very adaptable species. So there's not a one size fits all. So that's number one. Number two, if you're in this bathroom taking a shower and you come out and you find your baby's been screaming, you don't have to worry that your baby's been traumatized or is going to be suffering, long-term damage from that type of unresponded to alerting. Babies could survive, 20,000 years ago. We would have died, but your baby would have survived, would have been held and cuddled and fed. So they're very robust and they're very strong little beings. Having said that, there's a deal we make with them. It's transactional. I'm going to give birth to you, and I promise I'm going to take care of you. That's my responsibility to you. I hope later on you're going to help take care of me when I'm older. I'm not going to make you sign a contract to that, but there is an implied relationship that, as our kids get older, that they're going to help us when we need help as well. And our family, that's what family is. But part of that contract is in the beginning, we're going to give what we can to babies to make them not just meet their needs, but to be judicious and raise them in a way that's going to teach them to be strong and perseverant and dedicated and have the qualities and the personality traits that we think are admirable and we want to encourage. But that begins with intimacy. Intimacy and being able to have a close relationship turns out to be the most foundational part of being a human being, of our social contract. And the first step of intimacy is trusting the people that you're with. If you can't trust the people that you're with, then you're never going to have a happy life. And actually, I would tell this oftentimes to my patients, and it's something that we talk about in the Happiest Toddler book, which is that everyone talks about unconditional love. And of course, it's great to be loved. But if someone loves you and they don't respect you, it's going to be hell. If they respect you and they don't love you, that's not optimal maybe, but it's something you could work with. And so it turns out that respect is much more important and foundational in terms of having a healthy relationship, even than love. And so by meeting your child's needs and being respectful, you're actually building a strong foundation for your child's ability to have intimate relations, friendships, partnerships later on in life. And that's why it's important, but again, not critical. If you missed it, if you weren't there for every single cry, you don't have to feel like your child is so fragile, because they're not, they're robust.
Yeah, thank you. So a couple questions from out in the audience. I'll kind of weave back and forth. Somebody has seen the SNOO ads that babies can sleep through the night at 2 to 3 months, but my pediatrician says a 9-week-old shouldn't go more than 5 to 6 hours between feedings. I know we have lots of opinions and different perspectives and things on this, but how long from your perspective should a 9-week-old be able to sleep?
Well, it's not a pediatrician's opinion. It's up to the baby.
That's true. That's absolutely true. The baby decides most of what's going on in our lives.
That's right. And so every baby's different, right? And but here's the curious thing. Most of the people who are listening to this and are going to listen to this probably sleep in a bed. You know, they may like to use a pillow. They may even have their favorite pillow that when they can travel, they travel with. They may have their favorite sheets or their favorite mattress or their favorite duvet or whatever. Now, if you took that all away from them, you know, hey, just sleep on the cement floor. Could you do it? Of course you could. You're not going to sleep well, maybe, certainly not as well as you would with all of your sleep cues around you, but you are going to sleep. So it's the same thing with babies in the womb, 24 hours a day. Every time they sleep, they have sound. The sound in the womb is louder than a vacuum cleaner. The blood flow sound. They're constantly rocked. Every time you breathe, even when you're asleep, you're pushing your diaphragm against the uterus and rocking your baby. And the babies are constantly held in that little ball. So for them to be born and we put them on the back and we put them in the dark silence with no motion, really? I mean, it's kind of crazy. It doesn't make sense when you think about it that way. You're making them sleep on the cement floor. Right. And they will, but they're just not going to sleep well. When you give them the rocking and shushing, then you're optimizing their ability to sleep. Now, in the beginning, they have to eat. You know, babies who are breastfed, especially, they have to feed every 2 hours. Now, that doesn't mean they have to feed every 2 hours throughout the night. Right. It means they may feed every hour and a half during the day and get a stretch of, I mean, in the beginning, you should be able to expect a 3-hour stretch and sometimes even a 4-hour stretch in the nighttime. And then you make up for that with lots more feedings during the day. And babies are interesting that way because they have a need for a certain number of calories in a 24-hour period. But if you give them more of those calories during the day, they require less of them at night and they just automatically sleep better. So by the time a baby is 2 months old, they have a very developed ability to sleep, to kind of string together these little sleep periods they have, because all of us have light sleep and deep sleep and even a little bit of wakefulness. Even adults wake up 3 times a night or 2 times a night. You may not remember that because you fall back asleep so quickly. But if you were to smell smoke or someone scratching at your window, you would remember it and you would wake up fully. And so babies are the same way and toddlers are the same way. They wake up 2, 3, 4 times during the night. But if there is rhythmic calming there, they're going to fall back asleep. And that's ultimately what SNOO does. And then if there's something bothering them, like their hunger increases, then that's going to wake them up. SNOO is not going to make a hungry baby sleep. It just doesn't work that way. Rocking a baby in your arms is not going to work. If they're hungry, they're going to cry no matter how much you jiggle them. So you can let your baby lead you. Once you establish the breastfeeding, once you really know that the calories are getting in well, your milk is in, you feel like your baby is peeing and pooping normally, then you can start letting your baby regulate things. And you can encourage it during the day. Like if your baby's sleeping more than an hour and a half, 2 hours during the day, I know what you would recommend, but I usually recommend waking them up during the day and then getting those calories in so they can sleep better at night. In SNOO, we've done by far the largest sleep study ever done on babies, over 40,000 babies. It's enormous. And what we've demonstrated that on average, a 2-month-old will have a 7-hour stretch of sleep, unbroken sleep. That's the norm. Some babies are 8 or 9 hours of unbroken sleep at 2 months of age, which we never thought they could do, except we knew they could do it because when you drive them all night in the car, we could see that type of behavior as well.
It's interesting. Yeah, no, I mean, we definitely talk about in our lactation class, like if any of you come later to that, you know, when you're really establishing early breastfeeding, then the baby day and night doesn't even seem to be very clear to them. And, you know, as you'll talk about more, but those first few weeks, we're really establishing the milk supply. We like to really wait, as you said, until we feel the baby's peeing and pooping well, the baby is thriving, and that you've gotten the hang of nursing. And in those early days, it may be as frequent in some stretches from every 60 to 90 minutes that a baby would eat, but sometimes, of course, it can stretch out. So just to clarify, you're talking more as lactation, or let's clarify what you were saying exactly in terms of what week you feel like you can start to follow that baby's lead.
Sure. And I'll tell you another fact in introduction of that, which is how do women do it in other cultures? What is the way that people are supposed to do this? And how have they done it for thousands and thousands of years? And if you look at the behaviors of, again, hunter-gatherer tribes in Africa and in Australia as well, they hold their babies all the time. They're all constantly in a carrier, right? And in this Kung San tribe, they feed their babies 3 to 4 times an hour.
Yep. Yeah, like little nips.
An hour, little nips. That's exactly right. Every time the baby kind of moves up, they swing the baby over, get a little minute or two on the breast, and then put the baby back. I'm not saying that's what you should do, but that is kind of what the normal human experience is. It turns out babies are adaptable, like I was saying earlier. And in general, what we've established now, and this is through La Leche League and through other, lactation consultants, in the beginning, meaning in the first days, number one, going to the very first day of life, babies are camels. They're born with an extra pound of food and water in your body, and you don't have milk. The milk isn't there. I mean, there's colostrum there in the beginning. And so little bits of this kind of yellowy, orangey, rich milk that's filled with white blood cells and antibodies and is incredibly important, but it's a very small quantity, like a half a teaspoon or a teaspoonful. Yeah, exactly. So what happens is the baby is born and the baby doesn't need a lot of food. And in fact, what happens for most babies is they're born, they look around, they go, holy cow, I didn't expect this. And within an hour or so, they fall back asleep. And they may sleep for 4, 5, 10 hours, 12 hours.
They take that amazing deep sleep.
Right. And then they wake up and now they're starting to get a little hungry. And so they might suckle, on the breast. And as the second day comes, especially the third day comes, they get hungrier and hungrier. They suckle more and more. And that suckling is what brings the milk in. And that's what we say. The milk comes in and you get a letdown, and then you can hear your baby. You hear that swallowing, which lets you know the baby is swallowing, but you also feel it, right? Your breasts suddenly swell up, and much more than they will later on, right? In the beginning, that's what they call engorgement. And your breasts are filled not only with milk, but they're filled with blood. The blood vessels are engorged, they're swollen, as they are the factories building the glandular tissue and creating this initial milk supply. And so in the beginning, the first couple of days, not much, and then more, and then they're sucking, every hour they're wanting to eat because they're hungry at that point in time. And then your milk comes in, and then you start feeding them, and they go, thank goodness the milk is there. And they start eating more and sleeping more. And then you start getting into a pattern by 5, 6, 7 days that they're nursing every hour and a half, 2 hours during the daytime, and maybe giving you a 3-hour, 4-hour stretch at night, then a feeding, then maybe it's 2 hours later, and then another feeding, and then maybe you'll get a 3-hour stretch. But 3 to 4 hours is pretty much the most you're going to see with a newborn baby. For a nighttime, longest stretch in a 24-hour period. By a month, 4 hours is routine, and some are going to 5 hours. And as I said, by 2 months, we routinely see 7-hour stretches. So that's kind of the way it adds up. But I want to say one thing that's so important and a huge misunderstanding that people have about sleep in babies. Everyone knows that babies don't sleep well in the beginning. They're going to wake up a lot. Their friends will tell you, you're going to be so tired. You think it's not going to be you, but it is going to be you. It's going to be exhausting. The way we train special forces like Navy SEALs to endure torture is we put them through sleep deprivation with the sound of crying babies over loudspeakers.
We do.
Yes.
Interesting.
So it's hard. And that's why getting an extra hour of sleep, is so super valuable. But people today think that, okay, they're not going to sleep a lot in the beginning, but then, right, it gets better and better and better. And by 3 months, 4 months, they're sleeping through the night. It turns out that's not the way it is for most babies. For most babies, it's a roller coaster. They're doing better. The milk comes in, they're sleeping pretty well that first week or 2 or 3. And people go, my baby's a great sleeper. We don't have a problem. And then they hit the wall. They go through a growth spurt. They go through a cold or a little reflux or a teething or a sleep regression. And it turns out every month or two, it's kind of a house of cards for some kids. It just kind of falls apart, and then you have to build it back again. And why do you have to do that? Because something disturbs them. They have some gas, they have some poopy feelings, they are hungry, they go through a growth spurt, and they wake up and they're in total silence, total darkness, all by themselves, and they go, "Hey, you with the long hair, come back here. This wasn't what you promised me." And so what happens in SNOO is when they wake up, they're being rocked, they're being shushed, they're being snugly held in the swaddling. Because today we pediatricians say, stop swaddling around 2 months, because we don't want babies swaddled rolling to the stomach, because that is a risk for the babies.
I'm glad you're addressing that, because we have a bunch of questions about swaddle. So let's just roll right into that.
Yeah, so swaddling is one of these things that cultures have done forever, all around the world, because when babies are asleep, they startle and their arms wake them up, and they try to suck their fingers, but they poke themselves in the eye by mistake. They don't have good coordination of their arms. And so swaddling babies has been an ancient tradition for thousands of years. I recommend swaddling them with their arms down, because if you swaddle them with their arms up, they tend to get their hands in their face and they upset themselves even more. So for good sleep, it really helps to have their arms down and secured. Hips have to be loose, right, because we don't want overly tight hips, because that can cause hip problems. So loose hips and tight arms is the way to go. And you don't want to overheat the babies.
What age, as a follow-on, do you recommend letting the arms out of the swaddle? We have somebody with a 4-month-old who's sleeping in the SNOO and is asking that question.
Yeah, so around 4 months is when, so our sleep sack, which I'm proud to say is rated the best swaddle in America according to the New York Times, and we just got the Best of Bump award, has little armholes. So if you say, my baby hates swaddling and I don't want to do that, you can always let the arms out. You don't have to secure the arms down. But almost 99% of parents find that when they let the arms out, the baby starts waking up more, until you get to around 4 months. And around 4 months, babies have better hand-mouth coordination. So this is kind of a cool thing as well that most people don't realize, which is a baby's development happens in a very particular sequential order, going from the head to the feet. No baby can walk before they can smile. No baby can crawl before they can follow you as you're moving across the room. So it goes down first the eyes, the face, the mouth, the neck, head control, shoulders, upper back, lower back, arms, hands, fingers, fingertips, and it goes in that progression. And so by 4 months of age, babies are getting much better at coordinating their shoulders and their arms to get their fingers to their mouths if they want to suck their fingers and soothe themselves. So 4 months is when you try one arm out, and it either works or it doesn't work. If you put the one arm out and then the baby starts waking up more, you go, whoops, she's just not ready yet. And you put the arm back in and you try it a week or two later. And usually around 4 months or 5 months, they're ready and able, and sometimes a little earlier than that, to have their arms out. The motion, we recommend stopping at around 5.5, 6 months. And why is that age picked? Because again, the babies tell us that. If you stop the rocking earlier, oftentimes you're going to go through some pain of a sleep regression. So there's this thing called the 4-month sleep regression, which is when kids are ready to be out of the 4th trimester. They're social, they're smiling, they're cooing, they're interacting. They love being with you. You are their rock star. And so again, they don't want to, when they get into light sleep at night, they go, hey, where'd the party go? And they want you to be with them. And sometimes there's hunger as well, but oftentimes it's really just that social need. And suddenly everything falls apart. And so with SNOO, we really caution people not to stop at 4 months, but to continue till 5.5, 6 months. And by then the brain has matured and it's able to maintain them in a sleep sequence of cycles. And so we have a weaning feature on SNOO where it has sound, but no motion. But if the baby cries, the motion will come back. And usually within 2 or 3 nights of the baby not crying and turning on the motion, the baby's ready to wean to a crib. And we very rarely have to do sleep training or letting babies cry. It's almost always that the bed sleep trains them. The bed gives them an extra hour or two of sleep. The bed prevents babies from rolling to an unsafe position. And so we're hoping and expecting that by the middle of the year, we'll get approval from the Food and Drug Administration to be the world's first SIDS prevention bed. And the bed is your 24-hour caregiver. And what's interesting is that if you were to hire a 14-year-old to hold your baby 1 hour a day while you cooked food or took a shower or did whatever you had to do, you'd pay $15 or $20 for that.
Hmm.
And SNOO we rent for like $4.25 a day, which is pretty much a Starbucks coffee. And so what we tell people is that, hey, you might think of this as a really expensive baby bed, but really the way I think about it is an incredibly inexpensive 24-hour, 7-day-a-week caregiver that you use for the first 6 months. And if you use it with your second child, then it's like, it's even less expensive. So that's why so many parents have found it, such a help for them.
Yeah. So the most common age then that you would recommend, somebody else is kind of piggybacking on the question, to transition to the crib, which is pretty much well linked to what you said, but I just want to clarify. They said, so what
It's
age?
around 6 months.
6 months
months,
they
I
would
would say.
actually transition to the crib. Okay.
And again, the baby tells us that, because when you put on the weaning feature and the baby sleeps well through the night, then okay, my baby is mature enough and they're ready to move to the crib. If you put on the weaning feature and your baby starts waking up more, then you go, I guess they're really not quite ready yet. Let me try it in a couple of weeks. And so it's kind of a bell-shaped curve. Some babies are ready a little bit earlier, some a little bit later. Of course, premature babies oftentimes have to be in more than 6 months to make up not just for the fourth trimester, but the third trimester that they didn't fully get before they were born. I have to say, just one more thing. Sorry, I want to add to this, which is we're doing a ton of research. We're now in 90 hospitals across the country using the beds in hospitals for premature babies and for new mothers to give them help, for isolating babies that have been exposed to COVID and things like that. But one of the things we're most excited about is the work we're doing on postpartum depression and anxiety. And what we've seen, and as you could well imagine, if your baby's not sleeping well, crying a lot, and you're feeling like there's nobody there to help you, you're going to get more depressed. And if you've got an hour or two more sleep and the baby is crying a whole lot less and you have a 24-hour helper, it just helps you. And so what we've seen is and we've done several pilots at universities showing that we can take depressed women, and not always, but oftentimes, by giving them this assistance, we're able to reduce their depression and anxiety and OCD symptoms. And now we have a couple of studies underway for the prevention of postpartum depression. And we're very excited about that work, because I think that we're going to see that we're going to make very strong impact on reducing this thing, which is such an unfair experience that women and sometimes men have to go through.
Yes, thank you. That's amazing. I'll look forward to hearing more of your research on that. It's incredible that you're doing so much sleep research that hasn't been done before, really. I also want to put this out there for anybody listening. If you are feeling anxious or depressed as well, please know that reaching out and getting help does make a tremendous difference as well. We do have mental health therapists who focus in pregnancy to postpartum, but also if you already in your life see a therapist or have one, just know that telling somebody, talking to people, talking to your pediatrician, right? Anybody, just knowing that we're all here for you and we want to make a difference if you.
That's right. And it's not a failure. I mean, now we're seeing all these celebrities coming forth and talking about it. It's almost 20%, almost 1 in 5 moms will experience either depression or anxiety, or these kind of odd obsessive symptoms of, checking the baby, having to check the baby every minute over and over and over again. Turning the light on and off 3 times before they turn it off, washing hands compulsively. Those things are not uncommon at all. And I want to say one thing about this, which I'm sure is your experience as well, which is that this depression is oftentimes not a boohoo sad depression. I mean, It can be tearful, but oftentimes it's an anxious depression where you can't turn off your brain, where you have intrusive thoughts, where you have a racing heart and fear and feeling like you just want to run away. Those things are very temporary, and they're related to exhaustion and this enormous new responsibility that you have. And it's important for women to recognize and to know that, man, there's a lot of help that you can receive, and you can get through this period. And then it's a much sunnier experience on the other side, if you are going
absolutely. And that's why we recommend for all of you, as you're thinking about this, pregnant, you want to think about how can I set myself up? And I hope you'll join me at my postpartum prep for postpartum class, but we really talk about setting yourself up in the way of what are the kinds of supportive things you need. So whether that's thinking about renting or purchasing a SNOO, whether that's thinking about booking a postpartum doula ahead of time, we work with you virtually, and sometimes just having somebody pop in, throughout the day, 1 hour, 2 hours here and there, just to really listen to you and hear where you are and make some suggestions. I can't tell you how much having the support makes a difference, or having postpartum care who pops in your home, depending. And we are in COVID right now. And so, there's a lot of factors around that, but do know that virtual support also makes a tremendous difference as well. So again, we are all in the business of caring for you first, and knowing that we're here for you.
And Jada, sorry, I want to add one thing to that, which maybe expands the conversation, which is a lot of times that challenging period happens when you're not successful at breastfeeding. Women oftentimes are judging themselves about that, and sometimes their extended family is judging them as well if the baby is crying a lot. And so it's really important to recognize the fact that while it's completely womanly and natural to breastfeed, it sometimes is a bit of a process in getting it going, and you shouldn't feel guilty about that. And you should reach out to Boober or La Leche League or your local lactation consultant, or your friends who have breastfed, but get help, because you don't want to wait and have painful nipples and have soreness and really start hating the process and feeling like you failed.
Absolutely not. I mean, that's, come to my lactation talk and we talk about those signs to know when it's not going right. People assume that you're supposed to have bloody cracked nipples and should be in pain, tremendous pain. And that's just not correct. And so
No, not at all.
many of the issues are quite fixable if we address them early, but not all people can or want to breastfeed, and do not have to. And not all people, some of you will sleep train or not. Some of you will have a sitter and some won't. Some of you will have, you'll go back to work and some of you won't. There's so many things in parenting that we really need to check in with our own selves. And, Boober is all about, we want to support you wherever you are on your path. So you can call us saying, I don't want to breastfeed, help me stop. I mean, that happens sometimes, you can say, I need mental health support, and we're just going to support you through that. So we just want you all to know that.
Maybe one thing, sorry, I know I keep butting in here, but the one thing I want to clue people into, and obstetricians and midwives should be talking about this, but I think they don't talk about it enough in terms of success at breastfeeding. People used to think that you have to rub your nipples or toughen them up or strengthen them or something like that, which you don't have to do at all. And in fact, too much nipple stimulation can bring on labor. So you want to be a little bit careful about that as you're in the later stages of pregnancy. And in fact, nipple stimulation is sometimes used to bring on labor when you want to bring on labor. But what is important to talk to your healthcare provider about is if you have flat or inverted nipples. When the breasts engorge and they fill with milk in those first couple of days, if your nipple is already on the flat side, meaning that it's less than maybe half an inch when it's stimulated and erect, then when the breast engorges, it kind of stretches it and flattens it out a little bit. And that makes it hard for the baby to kind of have something to latch onto. And if the nipple is inverted, that additionally makes it hard. So there are ways of helping your nipple extend and lengthen before you have the baby, so that by the time you have the baby, the nipple is more accessible to the baby.
So yes, if you are in the inverted nipple or flatter nipple camp, definitely reach out. We're happy to support and work with you ahead of time. I want to draw us back in a little to some questions that we've got about SNOOs and nap times. There's a lot of people wondering, should we always place the baby in the SNOO? Is it different for naps? And there's a couple questions about, is the SNOO used right from birth, right from when we get home? So can you address naps and when can people start using the SNOO?
Sure. So in terms of using the SNOO, you'd start right from birth. And if you didn't have that opportunity to do that, you can start later, of course. The longer the baby has been here, the more they start learning other ways of sleeping. So if you start at 1 month, for example, it might take 2 or 3 days for the baby to figure out this new thing and what you're expecting of them. But if you consider that in the womb, the baby is held and rocked 24 hours a day, then that's an easy transition for them into SNOO right away, even a premature baby. And then as far as naps are concerned, some people wonder, should I start training my baby to not be used to being in SNOO? And actually, it's quite the opposite. Like you don't need to, you shouldn't sometimes sleep in a bed, but sometimes sleep on a cement floor, just so you know how to sleep on a cement floor. You can pretty much keep a baby in SNOO, and in fact should use SNOO for all of naps and all nights. because the more you use it, the more the baby figures out what you're expecting. Same thing with breastfeeding. In the beginning, you really just want to breastfeed. You don't want to go breast bottle in the beginning because they can get confused. It's a different way of sucking. Once the breastfeeding is well established, usually after a couple of weeks or so, it's fine to introduce a bottle, maybe once a day, not more than once a day usually, just so the baby learns to take a bottle. Because sometimes if you don't give a bottle in the first month, and then you think you're going to offer it when you go to work in a few months, the baby might totally reject it. So there's this window of opportunity. And likewise, we see that with SNOO. Use it all the time. It's fine if your baby fell asleep while you went on a walk or something like that. Don't worry about that. But when you're home, you want to use SNOO as much as possible, because the more you do it, the better the baby learns, the faster and better the baby sleeps. And then it's actually pretty easy at around 6 months to wean the baby, because their brains are different. Their brains increase more than 50% in size between birth and 6 months of age. They're popping the popcorn up there. And so their abilities are dramatically improved. I kind of think of it kind of like feeding a baby. You start feeding a baby maybe at 4 or 6 months of age. And you might think, milk, I'm just giving milk for every single meal. Does that mean my baby's never going to eat food? They're going to be so used to milk that they'll never have solid food? You don't worry about that, because they're physiologically ready at, 4, 5, 6 months. And that's when you start the feeding. And same thing about sleep. A 6-month-old is radically different than a newborn baby. And they've learned so much by then that the sleep becomes much easier for them to regulate. And they don't really need a SNOO at that point in time. So use it to its fullest. That's how you get the greatest value. The baby gets the greatest value. And then around 6 months is the weaning period.
Thank you. And can you address, a lot of people have questions about baby wearing. I love baby wearing. I think it's a wonderful way to connect with your baby, go on walks. Babies often fall asleep there. So can you talk about safe sleep and baby wearing, and
Sure.
how that fits in?
Sure. I mean, what we've learned about sleeping in other situations, whether it's in a swing or a car seat or a baby carrier, is that there are dangers that you have to be aware of. And we know that babies have died in infant carriers. That's not to say infant carriers aren't safe. They're incredibly safe, but you have to take certain precautions. So you don't want your baby buried at the bottom of a baby carrier where they're bent into a little pretzel and their face is against their knee. You want babies to be kissable when they're in the carrier. So exactly right. So the head is up higher, and obviously the head and neck have to be supported, but the baby has an easy way of breathing, and is not going to get their face, covered or occluded. And then you can carry your baby all day long. And in fact, that's what human beings have done for thousands of years. And you don't, again, as you were saying, Jada, before, you don't need to worry, oh, my baby got dependent on that or used to that or whatever. It doesn't work that way. Babies love to be carried, and then they don't love to be carried. And they want to be on their own. They want to crawl. They want to do things. And you're going to try to carry your child. Your child's going to push you away and not want it. So you don't need to worry about overdoing it. And you don't need to worry if you're not carrying your baby. But I will tell you this, that throughout the day, the world is you don't want the world too exciting and overstimulating, but you don't want the world too quiet either for the baby. Babies need the rhythmic stimuli that they had in the womb. So holding and rocking and shushing and nursing babies so they can suckle throughout the day, that's like putting money in the bank. And then you can withdraw that money at the end of the day, which tends to be the fussier, more unsettled period of the day. So you can imagine if you were in Las Vegas casino and you were immobilized on a gurney, and you couldn't turn your head, and you just had all this noise and stimulation, and you did that for 10 hours. By the end of that 10 hours, you're like, I got to get out of here. Yeah, exactly. And that's kind of what the baby's life is during the day. Lights, colors, temperatures, flavors, sounds, smells. It's wonderfully exciting, but it can be fatiguing as well. And when you give them rhythms, you're able to recharge their battery and help to replenish their ability to maintain their state, maintain their level of calm.
Thank you. So before we get to the last few questions, we have so many questions. I know I can't get to everybody's. I just want to remind all of you to follow us on social. Grab your phone right now if you don't have it out. If you do, we're at Get Boober and at Happiest Baby. So I'm going to drop that into the chat so you can follow us. I know that we do a lot of different little teaching tips and videos and tools. And as well, I'm going to put the website again for Happiest Baby, where you can learn about SNOO and see the actual videos, which make a big difference.
Oh, and Donna, I forgot to tell you also. So we also have our little SNOO bear now, which is a white noise teddy bear. And it's also a little finger puppet so that you can play with your child. But anyway, this allows you to continue the white noise that babies are used to in SNOO. And that white noise, by the way, is very different than other white noise. It's been specially engineered to imitate the womb. And then we just launched, we're very excited about this. We just launched a new dress yesterday, which is a pregnancy dress and a nursing dress. So it has a very easy way of nursing your baby, and it also grows with you as your belly is getting bigger and helps you with your recovery. So you can sleep in it, you can use it during the day, and
I'll have to check that
that
out.
we're really excited about.
Very cool. Awesome. So we have a few questions. I'm going to blend them in together about blackout shades, few ways to approach sleep in terms of natural light, blackout, darkness. Talk about that, if you don't mind, just all of what's the best level of light for baby sleep.
Sure. And most people use a little bit of light in the room just so when you come in, you can kind of find your way. But it's a little 4-watt light bulb, like a night light. A yellowish color is usually best. Blue or white light tends to wake you up more. And different babies are different. Like I said before, some of them are much more sensitive to light. Others, you take them in the stroller, it doesn't matter if it's bright light or not. They pull away from it and they go into their sleep actively and ignore the light. So you kind of see what your baby responds to. But if your baby is having challenges napping during the day, you certainly can try blackout shades and see if that makes a difference. And of course, use white noise. I recommend white noise for years. I mean, I use white noise at night. A lot of adults, millions of adults use white noise to help them sleep, kind of like you would use a blanket or a pillow. And so don't worry about using white noise. I would definitely recommend that as your best friend for the first several years of life, at least.
Thank you. A couple questions about the owlet different other technology that's out there monitoring. Any thoughts that you have? Let me try to, I remember seeing that one. There's a couple of them around. So yeah.
So the risk of infant sleep death, there are 3,600 babies who die in the United States every year. Half of them because they roll to the stomach, and half of them because they're brought into bed with their parents and they die in bed with their parents. And then there's a smattering of other ones, but almost all of them, 95% of them are related to sleeping on the stomach or being brought into bed. We're excited about SNOO because SNOO secures babies on the back. They cannot flip to their stomachs. And so they're 30 times more likely to be on the back than babies who are not in SNOO. And we see babies are 6 times less likely to be brought into bed and the mother accidentally falls asleep with her baby in an unsafe position because the babies are sleeping so well in SNOO. So we're super excited about SNOO as a way of preventing infant sleep death because we keep them on the back and we keep them in a safe location. With Owlet, that's a monitor to measure when your baby stops breathing, basically. And so if you have ways of preventing those problems, I think it's probably a very, very low risk that you would need that type of a monitor. But if it's good peace of mind for you, it's not a reason not to get it. You know, if that's going to help you to not be anxious and sleep better, then just you use that, but be aware that the sock can fall off and sometimes the alarm goes off. So it doesn't always, when the alarm goes off, it doesn't always mean that your baby has stopped breathing. And that's, you know, that's the way I look at it. Pediatricians do not routinely recommend using monitoring for babies.
Thank you. And I guess I'll ask you last question, a couple questions about swaddles, and then we'll wrap up and we'll have to meet again because we always have such interesting conversations. I feel like I could talk to you for hours. There's so much in there. So somebody asked, do you recommend putting the baby in the swaddle and then into the SNOO, or leaving the swaddle open or clipped into the SNOO, and then zipping them in when they're already asleep? So that was one question. And then there's something about, is it safe to double swaddle in the SNOO? We've been using the nested bean swaddle inside of the SNOO swaddle. Is that unsafe?
So you can use other swaddles inside. You can use a plain, you know, blanket, muslin blanket. You can put them in a SNOO sack inside of a SNOO sack, or a sleepy, which is our swaddle blanket a love to dream or a nested bean or whatever type you want inside of the SNOO sack, but you do need a SNOO sack to attach it. And if the baby is in a SNOO, the SNOO won't work unless the sack is attached. We do not want babies in SNOO, and this is something that parents need to know about. There are other rocking beds, but when a bed is rocking, that baby can roll over more easily. So when a baby is in a rocking bed, you need to secure them on the back for them to be safe. The only thing you need to do if you're double swaddling a baby is feel the ears, feel the nose, make sure you're not overheating your baby. That's the one thing you need to be aware of. And then as far as swaddling outside of SNOO, we always swaddle babies outside of SNOO. We swaddle them with our arms. When you're nursing a baby, you don't let them go like this. You know, if they're flailing around a bit, you kind of restrain their arms with your arms. So swaddling in the SNOO sack, I usually do that with babies when you're nursing them or when you're carrying them around, and then you just put them in SNOO and attach it, clip it on to the safety clips. That's the way I usually use it.
Fantastic. So I have one last question for you. First, I'm just going to quickly launch a poll to hear what else people want to hear about, because that's really helpful.
Oh, super.
Right.
Yeah.
So kind of curious what you guys want to hear about. And then another last question for you is, I have a couple questions about temperature of the room. So what temperature should we keep the room with a newborn baby, and how should we dress the baby underneath the SNOO sack? And I think that's the last question we'll get to today.
So from a temperature point of view, most people set the room temperature at around 70, 72. But, you know, there's all sorts of variations depending on your house, you know, whether you live in a warm climate or a cold climate. And so the best thing is not looking at the room temperature per se, although obviously you don't want it freezing cold or terribly hot if you can avoid that. But it's to check your baby and read your baby's cues. So like I mentioned, if you feel the ears and they're cold and you feel the nose and it's cold, your baby needs to be extra swaddled or needs a hat or needs to be warmed up in the room. On the other hand, if the ears are red and hot and you feel the neck and it's a little bit sweaty, your baby is overbundled or the room is too hot. And it's kind of like Goldilocks, right? If they're just in the middle, it's just right. And that's what you're looking for.
Thank you. All right. Well, thank you all for coming out today. Let's see. We have a lot of people interested in lots of different things. So many of you, I'll just put it out there, what people were interested in.
Can I take the privilege of one last thing just before?
Oh, of course.
Which is that I know we're talking all about babies, and when you're having a baby, it feels like your whole world is going to be babies, but you'll be shocked at how quickly the baby period passes. 8 months in your life in the past went by like 8 months pretty fast. And the baby period, while it feels like it's interminable, a day feels like a year, but a year will feel like a day also when you're on the other side of it. And so I want to tell people that there is this book and video called The Happiest Toddler on the block, which, like the 5 S's, they're kind of surprising and unconventional and counterintuitive techniques to communication-based techniques that help you to improve your child's patience, cooperation, emotional resilience, and reduce temper tantrums and outbursts. But the thing that I like people to know is that as much as we're concentrating on babies, and it's so wonderful, and we love talking about babies, between 8 months and 5 years of age, you've built a person. And most people don't have a lot of experience dealing with toddlers. And yet when you have the toddler, you feel like you're just winging it. So what I beg people to do is to spend 5 hours less of watching Game of Thrones or Queen's Gambit, and spend 5 hours reading a book. There are other good toddler books as well. Read a book about toddlers and start learning a little bit more about how to raise a child in that period, because it's challenging, and your expertise will really help you to succeed at your job.
That is right. And we've talked about doing this toddler talk, and all of these people's babies are going to very quickly grow. So we better schedule that soon, because we've already been talking together for quite a long time. So I'm sure we have plenty of people in the toddler zone who could really use that support. So we will absolutely schedule that and figure that out. So thank you all so much for coming out today. We really appreciate it. Check out the SNOO, check out Happiest Baby, follow them at @happiest_baby, follow us at Get Boober, visit us for whatever you need. And tomorrow we're doing Intro to Solids class. We will send you an email with some coupon codes and some links to SNOO if you haven't checked it out yet. So thank you again, everybody.
Thanks, everybody. Be safe out there, please.
Be safe, and thank you so much. Talk to you soon.
Bye-bye.
Bye.